Sarcopenia, a term that might sound unfamiliar, is a condition that can significantly impact those with type 1 diabetes. It refers to the gradual loss of muscle mass, strength, and function. While we often associate sarcopenia with aging, recent studies show that it can also be a hidden complication of type 1 diabetes, affecting individuals much younger than we might expect. Research indicates that sarcopenia is not just a concern for the elderly. It can affect up to 43% of adults with type 1 diabetes. This prevalence is alarming, especially when we consider that muscle loss can lead to frailty, increased risk of falls, fractures, and even disability. In fact, the risk of sarcopenia increases with age. But even younger adults in their 30s and 40s are showing early signs of muscle deterioration. This suggests that diabetes may accelerate muscle aging, making it crucial for those with type 1 diabetes to be aware of their muscle health. Interestingly, the situation is not much better for children and teens with type 1 diabetes. While they may not show a decrease in muscle mass, their muscle function, like jumping ability and coordination, often falls short compared to their healthy peers. This early deterioration could set the stage for more significant issues later in life. Key risk factors for sarcopenia in individuals with type 1 diabetes include older age and low body mass index, BMI. A low BMI, particularly below 18.5, consistently emerges as a strong predictor of muscle loss. Surprisingly, factors like diabetes duration and HbA1c levels don't always correlate with sarcopenia risk, which raises questions about the impact of glucose control over time. One reason type 1 diabetes may lead to increased muscle loss is how insulin is administered. Unlike the natural insulin that the body produces, which is released into the liver first, injected insulin floods peripheral tissues, including muscle. This unnatural exposure could disrupt muscle metabolism over time. Additionally, chronic high blood sugar levels can lead to oxidative stress and mitochondrial dysfunction, further accelerating muscle aging. When it comes to lifestyle factors like diet and exercise, the evidence is mixed. While we know that a healthy diet and regular physical activity are essential, studies show that adherence to a Mediterranean diet or caloric intake doesn't always correlate strongly with muscle health. However, structured exercise programs, particularly those that combine aerobic and strength training, have shown benefits in some trials. The implications of sarcopenia in type 1 diabetes extend beyond muscle loss. It can threaten independence and safety, increasing the risk of falls and hospitalizations. Unfortunately, many studies rely on adult diagnostic criteria, which may overlook sarcopenia in children and adolescents. To combat this issue, we need specific diagnostic tools tailored for younger individuals with type 1 diabetes, long-term studies to explore the relationship between glucose control and muscle health, and personalized plans that emphasize resistance training and proper nutrition. Raising awareness among clinicians, families, and patients is crucial for early detection and intervention. Sarcopenia in type 1 diabetes is a real and under-recognized challenge, but with proactive measures, it can be managed. Understanding the importance of muscle health is vital for anyone living with diabetes.